Good afternoon everyone, I am Dr. Vasudha Rao. I am a psychiatrist and a psychotherapist. So today I would like to address acute stress reaction which can happen after traumatic events. So what is defined as a traumatic event? Usually it is witnessing death, witnessing violence and threat of injury, life-threatening injury to oneself or to others, major life event which was not expected. So war scenes where people are getting killed or bombings, generally involving any threat to one's life or others. So these are considered as traumatic events. So what happens? How does the brain respond to such traumatic events? So post-traumatic event, for about a month or so, the brain can react to a traumatic event by thinking differently, feeling differently and behaving differently than how the person used to behave before the traumatic event. So it is very, very important for us to know how the brain responds to trauma. And the statistics show that if about 100 people are exposed to traumatic events, about 30 to 35% of them can go on to develop long-term trauma symptoms. So this is precisely the acute stress reaction is not called a disorder for a reason. It is a reaction because it is an injury which happens to our mind, and mind is nothing but it is embodied in the physical brain. So it is just like an inflammatory reaction after you meet with a small injury or an accident, or you have a skin cut or a small burn injury or something. So your immune system kicks into action and it wants to contain the damage. It wants to prevent any infection. So the mind tries to digest the traumatic event. Hence there is definitely going to be a reaction. So this is not necessarily a disorder, and it doesn't really indicate anything about a person's competence or the person's resilience. Or how good the person is at handling life crisis. So, but certain categories of people are definitely at risk of developing a post-traumatic stress disorder. So anybody who has had a previous experience with traumatic events, so the brain is already primed to develop a similar traumatic reaction after any other traumatic event later in life. So we have to keep this in mind, but we also have to acknowledge the fact that acute stress reaction can happen to all normal human beings. It can happen because one is a human being and one need not be previously traumatized or suffer from a psychiatric illness in the past. So taking this forward, so how does a brain think differently? So it is very important to understand these changes and recognize them and support people as they undergo an acute stress reaction. So how do people think differently? Generally they suffer from a very poor concentration even in their normal routine, and recurrent dreams of the traumatic incidents at night. This can also lead to flashbacks of the traumatic event. Like, the person doesn't want to remember it, but the brain sort of regurgitates the event. So it's an involuntary memory which keeps flooding one's awareness. So this is called a flashback event. And negative thoughts about suicide also can occur. Thoughts of self-harm in a previously absolutely normal person who did not suffer from these thoughts before. So the person, given the intensity of stress, can actually go on to commit a self-harm act or complete a suicide. So it doesn't mean that this person is psychiatrically ill. It definitely means that the person was overwhelmed by the traumatic event. So this person can also behave differently. So if you ask me how, the person may not exhibit interest in meeting with other people, so he may remain withdrawn and may prefer to stay alone, may feel very, may experience poor appetite, he may not be able to sleep properly at night. So this can continue for about 1 month, after which the brain has some time to deal with this trauma. Right? And if the symptoms continue to persist after this 1 month, so it will be diagnosable as a post-traumatic stress disorder. Apart from this, the thinking and the behaving. So how does a person feel when the traumatic event happens? So the person generally can feel very anxious, excessively anxious. Mostly the anxiety will be whether the traumatic event will reoccur, right? So how the trauma may come back to them in different ways. So that is anxiety which spikes up. Irritation also can be exhibited when people want to know about it, people question them about these events, like what happened, how did it happen. So when other people are even exhibiting simple curiosity about the traumatic event, it may irritate the person who was traumatized. And the person generally wants to avoid anything which reminds them of these incidents, like the places, the people, and the situations. For example, if they witnessed an accident at a particular junction, so they would not like to go to that traffic junction. So they will do everything to avoid that place. So if the trauma is connected to a particular person, they develop an avoidance towards that particular person. So what we have to understand is that acute stress reaction is not a disorder. It is a condition. It is a way mind reacts to traumatic events. And we all react because by the virtue of being human, we definitely have some reaction to something which threatens us or others. So we will keep this in mind, and kindly do not go with the myth that everybody who commits suicide is diagnosable with some mental illness. That is simply not true. Even the statistics, the research, nothing supports the common notion, the common myth that psychiatric disorders will lead on to suicide all the time, and all the suicides will have a psychiatric illness context. So I hope that this video and my efforts are useful to whoever needs it. So please DM me with your queries, and please ask me questions, and feel free to send me your comments and feedback, anything at all.